Hello, my name is Nancy Pike. I am a professor and the founding Associate Dean for Research at the Sue and Bill Gross School of Nursing at the University of California, Irvine. I am the current chair of the American Heart Association Council on Cardiovascular and Stroke Nursing and the chair of this important scientific statement titled Nursing Wellness in Academic and Clinical Cardiovascular and Stroke Nursing.
Hello, my name is Cindy Dougherty. I'm the prior chair of the CVSN Council and a professor and adult nurse practitioner at the University of Washington School of Nursing. I am vice chair of this paper with Dr. Pike, whose original idea led to this important work.
I'd like to thank the American Heart Association for commissioning this critical and timely statement.
And thank you also to the writing committee members who span nursing practice, nursing education, and nursing science with national and international cardiovascular and stroke nursing expertise.
I'd like to talk for a few minutes on why this statement is so important. As many of you know, we have a critical nursing shortage. Nursing is an essential part of our healthcare system workforce. Cardiovascular and stroke nursing represents one of the largest specialty areas requiring expert knowledge and clinical proficiency to ensure safety and quality patient outcomes. The concept of wellness or nursing wellness is not new, but has come to the forefront over the past 5 years, in particular during and post-pandemic, due to nurses experiencing unprecedented demands leading to professional burnout. The nursing workforce lost more than 1,000 RNs a few years ago, which was the largest single-year drop in 4 decades. This trend is likely to continue as nurses aged 35 and younger report the highest turnover intention as well as the lowest job satisfaction and emotional well-being compared to nurses aged 55 and older. The nursing workforce is aging with half approaching retirement in the next decade. This is not only a striking reduction in number, but also a decline in nurses with clinical proficiency, expert knowledge, and mentorship ability to mentor the next generation of nurses. This aging factor is also prevalent in academic or nurse educators. 63% of nurse educators are age 50 and older, and this shortage will continue to worsen, further reducing student capacity at most institutions and restricting the growth of the profession. This shortage also impacts nurse scientists or nursing researchers, with less than 1% of today's nursing workforce earning a PhD. With the rising prevalence of chronic disease, in particular cardiovascular disease, the need for nurses in the hospital setting will increase by 40% over the next year. However, the nursing workforce is only expected to increase by 6% over the next decade, and this definitely will not meet the service demands at most hospitals. Thus, the goal of this scientific statement is to outline the drivers of burnout or intent to leave the profession that impact wellness, specifically to academic and clinical cardiovascular and stroke nursing, and propose system-level interventions to mitigate and support future and current nurse clinicians, nurse educators, and nurse scientists.
I will next discuss the roles that nurse clinicians, educators, and scientists play in the nursing profession and point out key drivers of nursing burnout. The nursing workforce is comprised of staff nurses who work in outpatient, inpatient, or community settings, nurse educators and nurse scientists working in academic and clinical environments, and advanced practice nurses who provide direct services to patients and families. The staff nurse or clinician specializes in the practice of cardiovascular and stroke nursing by obtaining specialty certifications and practices at the bedside. The nurse practitioner is nationally certified in a variety of roles in cardiovascular and stroke nursing and serves in the role of nurse practitioner or clinical nurse specialist. Clinical specialization includes cardiovascular conditions or populations across the lifespan, such as preventative cardiology, heart failure and transplant, electrophysiology, mechanical circulatory support, or congenital heart disease. The academic educator specializes in teaching at the university or college level, where they develop curricula, design instructional materials, and assess student competency. Nurse educators play a crucial role in preparing the next generation of nurses for the workforce. The nurse scientist is a nurse with a PhD who conducts scientific research that contributes to the development of new knowledge and patient outcomes. Nurse scientists compete for research funding and disseminate research findings through presentation at scientific meetings and publication in professional journals. In addition, nurse scientists also mentor DNP, PhD, postdoctoral students, and early career faculty. Within these nursing roles are key drivers that contribute to burnout. Are depicted in Figure 1 of the paper. First, for the hospital-based staff nurse or clinician, stressors include excessive workload and long working hours, perceived low compensation, exposure to death and suffering, working in high pressure or high stakes patient environments, and the high complexity associated with care in the acute cardiovascular and neurovascular condition. These stressors were heightened during the COVID pandemic, where fear of infectious exposure contributed to an already stressful workplace. For academic educators, the stressors include growing workload demands secondary to nursing faculty shortages, increased teaching assignments resulting in loss of work-life balance, and dissatisfaction with workload, salary, and availability of teaching support. For nurse scientists, the stressors are balancing research responsibilities in addition to clinical practice, teaching, and administrative responsibilities, securing research funding, meeting grant deadlines with limited institutional support, publication requirements, and mentoring responsibilities.
Next, I'd like to mention some of the strategies to mitigate burnout across roles. One of the main findings of this paper are that many of the key drivers and strategies to mitigate burnout or improve wellness are not solely specific to cardiovascular and stroke nurses, but to all nursing roles in general. And many wellness programs are already being implemented at many hospitals or teaching institutions. Table 1 highlights strategies based on role type. For the staff nurse, the main areas of focus were related to strategies to improve the working environment and professional growth and development. Just to name a few strategies, the use of technology to minimize charting burden, which takes away the nurse's time from patient care, mandated workload and patient assignment policies, flexible scheduling, and mentorship and leadership training programs that teach effective teamwork and communication. For the nurse educator, the main areas were focused on teaching support and career support and compensation. A few strategies were instructional platform and competency-based learning specialists available for consultation if needed, classroom management strategies for in-person versus remote type learning environments, leadership mentoring and reduced teaching and service workload for early career faculty, and equitable compensation compared to clinical colleagues and educational debt relief programs. For the nurse researchers, like the nurse educator, the main areas of focus were on research support and compensation. To name a few strategies, programs to assist the transition to becoming an independent researcher, such as the use of discretionary startup funds, reduced teaching loads or protected time, and mentorship across academic stages, and indirect research support such as grant writing, reviews, statistical support, and access to research offices and laboratory space, and similar equitable compensation and debt relief programs, but also travel assistance to disseminate their nursing science. The paper also touches upon the need and the importance for recruiting and retaining a diverse nursing workforce across roles. This will help us to broaden our understanding of cultural specific nuances in patient care and treatment, strengthens trust when their clinician or nurse researcher shares the same ethnicity, race, and language, and faculty in the classroom that mirror their students' race, ethnicity, can be a role model for success and promote a classroom of inclusivity and belonging.
To address burnout and stress and to enhance resilience to sustain a strong nursing workforce in the future, we're all called to action to solve these issues in nursing practice, nursing education, and nursing science. As well, future research should include exploring strategies that ensure diversity in the nursing workforce, creating resources for wellness for the types most often sought, focusing on the development of a culture of wellness, testing interventions specific to settings and roles, and analyzing the cost-benefit of wellness-based interventions. We are very excited about the publication, and on behalf of the Cardiovascular and Stroke Nursing Council, we invite you to read it for further details.
In summary, the future of cardiovascular health and healthcare systems relies on well-educated and experienced staff nurses, APRNs, academic educators, and nurse scientists. With the critical shortage of nurses, stress, exhaustion, and burnout threatens the sustainability and well-being of the nursing profession. However, many nursing organizations and academic institutions are already taking a closer look at preserving this vital workforce. On behalf of the writing committee and Dr. Dougherty, thank you for listening to this brief introduction to this very important paper. Thank you.